I'm Robert McMullen. I'm a psychiatrist that's specialized in psychopharmacology for over 30 years, and I've added TMS, transcranial magnetic stimulation, to my armamentarium. And the question now is, how do you proceed to treat someone with a major depression who's never received treatment? I would start out with using some medication and not start out with TMS usually. I would use TMS when the medicine has only worked partially. And one should have some blood tests and a good history. For instance, if your thyroid is a little low or your vitamin B12 is a little low, these contribute to having depression. Also, vitamin D, which is very commonly low because it's a steroid hormone that we make when we're in the sun, and we're no longer farmers or hunter-gatherers, so all of us basically are low in this. Those things need to be looked into right away, and then usually you would start someone out on one of the standard antidepressants, like Cymbalta, which is called duloxetine, or Zoloft, which is called sertraline, or Wellbutrin, which is bupropion, and start out slowly on these and go up slowly. You should usually go slowly. Going up fast doesn't usually get people better that more quickly, and if you go slowly, you have time to adjust to it and you'll have much less side effects. And usually in 10 days or 2 weeks, you're seeing some benefit. And frequently by 6 weeks, people are all the way better or close to all the way better. It doesn't always happen that way, and if it doesn't, then one tries something else, or one adds something in. It's actually not such a great idea to jump from antidepressant to antidepressant. There's a psychiatrist named J. Amsterdam in Philadelphia, and for a very long time he's been pointing out that people who are very treatment resistant and have tried many different antidepressants, that it seems to him that part of the reason they're so treatment resistant is they've been taking all these different antidepressants, and it may somehow be making them worse. So it's probably better that if you start out on an antidepressant and it begins to work a little, that you not change to another one, but stay on that one and then add something else in. Either add another type of antidepressant that works by a different mechanism, or add in some of the other things that we use to augment an antidepressant effect. For example, fish oil, a thyroid hormone called T3 or Cytomel, a very low dose of lithium, a very low dose of Depakote, NAC, which is N-acetylcysteine, which is an amino acid. And these all have significant evidence that they help bring people out of depression. About 50%, or close to 50% of us that have chronic depression are a little bit bipolar. In fact, we're all a little bipolar in the sense that we have days and weeks where we're doing a little better, and then days and weeks where we're a little flat. And Dr. Eastwood in Toronto, I believe in the 1980s, did significant research showing that this was true for everyone. But when one has some significant bipolarity, that you've had mild highs at times where you get very excited about a new project, and for days or weeks you're sharper than usual, you need a little less sleep, you're just sleeping 6 or 7 hours instead of 8 hours, but you have more energy than ever, and you're very focused on what you're doing, then that is often a mild high. It doesn't mean it's pathological, but it means that there's a little bit of a bipolarity, an up pole and a bottom pole. And that changes things in the sense that it predicts that certain medicines are a little bit more likely to work. For example, it predicts that using Lamictal lamotrigine is very likely to have a good antidepressant effect. And that's great because lamotrigine usually has no sedation, there's no weight gain, and there's no sexual dysfunction. And it actually works at a relatively low dose. It was originally used for seizure disorders in 1994 and 1995, but immediately the neurologists noticed that it brought a lot of people out of depression. And they told this to their friends, and within a year or two, some psychiatrists were beginning to use it. I started with it in 1996. And I believe it was in about 2003, it became FDA approved for depression. And if it's something that would work, it's a no-brainer that one should use that because it has usually less side effects than everything else. Another thing that would help out adding in if one has a little bit of bipolarity is a little bit of lithium or a little bit of Depakote and fish oil. And these things do not need to be used in big doses usually. They can be relatively small doses. I now have 41 people that I have collected in the last 2 or 3 years who had a significant antidepressant effect from 150 milligrams of lithium per day. That's sort of like taking half an aspirin. In somebody who's very bipolar, which is called manic depression or bipolar 1 disorder, where their highs are gigantic and they go out and buy 2 Jaguars because they're going to start a couple of businesses and they'll be rich by the end of the year, so they might as well buy them now. They in lithium, they would need lithium 1,200 milligrams a day, 1,500. So taking 150 is a very low dose. It's the smallest pill they make, and I didn't even know that dose existed until I'd been out of practice 10 or 15 years. But I have all of these people who have responded to that low dose within a week or two. And we think there's a lot of other people that you add lithium 150 milligrams to whatever they're on, and if they're doing really well 6 months or a year from now, it may actually be from that lithium.
And what about TMS?
Well, a good 25% to 50% of people are going to have an inadequate response to antidepressants, or they're going to find it very hard to tolerate a dose that's high enough to really take care of their depression. Those people should seriously think of having TMS, because TMS is just a giant magnet that goes on and off, like an MRI. It's the sound that the TMS machine makes, it's the same sound that an MRI makes, and it's for the same reason. That when electricity runs through a copper coil, it turns it into a magnet. And when that pulse of electricity goes through these copper wires, all the wires separate just slightly, and then they bang together again, and that's the sound you hear, the click. When you do the treatment, you're doing a treatment usually on the left forehead or the right forehead, and the magnetic field is going on and off very suddenly. And the beauty of it is the magnetic field penetrates the skull very well, and it's not blocked by the skull at all. So it's very easy to have an effect on the brain and to either excite and stimulate the brain underneath the magnet, or to do the opposite and inhibit and quiet down that area. And we have ways of figuring out what we think is the best way to do it to help people with their depressions. And it's also being used off-label to help out with OCD and Parkinsonism and post-traumatic stress disorder and other disorders. And the TMS, in addition to having practically no side effects, you might get a headache or something the first couple of times, you get almost 50% of people all the way to normal, and then the benefit often lasts for months, if not years. And then when they relapse, with all chronic illnesses, you expect some relapse, then they don't need another 30 treatments. They usually come in and they get 5 or 6 treatments, and then they're back to normal, and then they just come again if they have another relapse a few months later or a year later, something like that. So it's really having a very long-term benefit, which is sort of surprising. Now, most people stay on medicine after their TMS. So if they're on some medicine that's partially working and they're not having many side effects, it's a good idea to stay on that, because it seems that prophylactic medication is important. So to stay on something to prevent the depression from coming back. Now, if somebody's having very many side effects, then you might want to lower the medication and see if you can get by with less. I had one young lady who had really severe agitated depressions, and she'd get hyper at times and get speedy and energized and try to study, and she had severe panic attacks and just massive anxiety. And when she was 21, she said, "Dr. McMullen, how am I ever going to get a career or get a husband, because I haven't finished a single college course?" And I said, "You're right." So we started the TMS the next day, and with 20 treatments, she really felt normal. And we did another 8. She had 28 treatments. And then we cut down her medication a lot. She was on like this much medicine, and she ended up on half as much. And then 2 years later, I was talking to her on the phone, and I find out that she's taking physics and calculus and advanced biology. And I realized she was aiming higher than nursing school. And a month after that, I found out she made all A's. But talking with her, it turns out that she stopped one of her main medicines. She'd run out of it, a mood stabilizer. And I was a little unhappy. It happened to be carbamazepine, but it could have been Depakote, divalproate, whatever. And she was doing okay. And I wanted her to go back on a little, but she didn't. But she stayed okay. And now she's 4 years out and still has not relapsed. And she transferred to an Ivy League school from community college because she wanted a more rigorous school. And she's in her 4th year of college now and is planning on medical school next year. And she's only on 1/4 of the medication she was originally. I believe she's on lamotrigine, and she might be on a tiny dose of lithium and a small dose of thyroid. I'm not sure offhand. But the main thing is just the lamotrigine. And this is an amazing outcome for somebody that had been anxious, agitated, and depressed since she was 10 or 12. And I treated her for 6 years, from when she was 16, and only got her maybe halfway better, and not well enough to really to study in college or get to classes even. So the benefit can be very dramatic, and then it can be quite long-lasting. I would never have dreamed that she would go 4.5 years now without needing a little touch-up TMS. Someday I expect she will have some depression again and need a few treatments.
Thank you very much, Doctor.